Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. Governor Rotimi Akeredolu gets his second shot of the Oxford AstraZeneca COVID-19 vaccine, assures residents of its safety. Delta State decentralizes vaccination points to increase access and improve residents' response. And India records more than 6,000 deaths in a 24-hour period for the first time. Now, according to the Africa Centers for Disease Control and Prevention vaccine dashboard, only 2.08% of Africa's population has been administered with one dose of vaccinations, while 0.61% of the population have received 2 doses. Only 0.63% of the population has completed the full dose on the continent. The Africa CDC says the vaccines available to Africa represents a small portion of global supplies, even as purchase, delivery, and administration of the doses remain significant. Meanwhile, the virus continues to spread around the world, with Nigeria recording 64 new cases last night in 10 states. Let's take a look at the update.
The latest figures from the Nigeria Center for Disease Control, NCDC, shows 64 new infections reported from 10 states in the last 24 hours. Yobe had the highest figures of 18 positive cases, followed by Lagos and Delta with 16 and 10 cases. Katsina recorded 7 cases, Gombe had 5, 2 cases were recorded in Edo, Kanu, and Rivers, while Kaduna and Kwara had 1 each. Clarifying the figures, the agency reported 0 cases from the FCT, Plateau, Nasarawa, Sokoto, and Imo states, as well as a backlog of cases from Delta from 27th of May to June the 7th. The latest figures has raised the total number of confirmed cases to 166,982. 72 additional recoveries have been made in the last 24 hours, increasing the number of discharged patients to 163,331. According to the agency, FCT Lagos and Ondo states account for states with the highest number of cases on admission, while Ogun, Nasarawa, Taraba, Sokoto, Cross River, and Kogi states currently do not have any case on admission. Till date, more than 2 million samples have been tested so far, while a total of 1,534 cases are still active. In Africa, more than 4.9 million cases and over 133,000 deaths have been reported on the continent. According to the Africa Center for Disease Control and Prevention, Nigeria has administered over 2 million vaccines of the first dose of AstraZeneca vaccine to its eligible population. Globally, more than 174 million confirmed cases have been reported from several countries, while the death toll has surpassed 3.7 million.
And in the southwest, the Ondo State government has flagged off the second dose of the COVID-19 vaccination in the state. Governor Rotimi Akeredolu, his wife, and top government officials received the vaccine at the governor's office in Akure, the state capital. Afterwards, the governor put to rest the fears of some people on the negative health implications of taking the vaccine, noting that the vaccines have been tested and certified safe for use by NAFDAC.
This vaccine we are taking has been tested. It has been certified safe for use. 12 weeks ago, that's about 3 months. So it is not safe for use while we see here. It is safe for use. If all of us here who took it have died now, then I won't take it again. But we won't die, we will be alive. Yeah. So NAFDAC, World Health Organization, everybody has certified this as safe. That I have talked about what it could do for us. But you are not 100%, I've said so, prevented from COVID. So we'll continue with this.
in order to ensure a more efficient and effective vaccination program, the Delta State government has taken the program nearer to the people with vaccination centers now stationed at the premises of corporate organizations to allow workers who do not have the time during working hours the opportunity to get vaccinated. This is also in addition to services rendered at the various primary healthcare centers across the state.
The Delta State government commenced the second dose of COVID-19 vaccinations on the 4th of June 2021, with top government functionaries taking their turns at the Executive Council Chamber, Government House, Asaba. Afterwards, residents through various orientation channels in the state are being encouraged to take advantage of the opportunity, especially those who had earlier taken the first jabs. At one of the primary healthcare centers in the capital city of Asaba, vaccination is ongoing with just a few people responding, maybe for lack of time. The authorities here say that on the average, only about 50 people come in to get vaccinated, so the idea to station vaccination centers and corporate organizations was born.
Some are coming out, some are not coming out. They are still afraid of the vaccine because of that's so many talks, theories that the vaccine will kill people after 2 years. And then we advise them, we encourage them to come and take that. Nothing will happen to them.
This is one of the banks in Asaba, and workers here strolling one after the other to receive their jabs.
Most of them are testing that since they took the vaccine that they felt okay and they are healthy.
Some of the staff are pleased with the arrangement, as bringing the vaccination to them has made it easier, regardless of the conspiracy theories associated with the vaccine.
I'm not scared of anything whatsoever, and it has come to stay, and people that need to take it. I advise everyone that has not taken to come and start up the dose and complete it.
Once again, residents have been assured of the safety of the vaccine and admonished that to win this fight, everyone must embrace both pharmaceutical and non-pharmaceutical prevention strategies available in order to reduce the transmission of the virus.
Well, joining us for more from Delta State is Dr. Michael Morko, who's the Senior Special Assistant on Health Monitoring at Delta State. Welcome to the program.
Thank you so much for having me once again.
All right, tell us, is there a dearth of persons who have taken the first dose not going for their second shot? And, why is this? Especially the fact that you've brought up this technique in taking the vaccines closer to the people.
Yes, thank you very much for that question. Really, I believe that the people would respond, positively to the second dose of the vaccination program. You'll agree with me that we had a lot of issues, issues that borders on rejection of the vaccine. Majority of persons, including some educated persons, will tell you that the vaccine is employed, or the vaccination program is employed to inject microchip into the human body for monitoring, etc. So we have had issues that borders on rejection, etc. But what we are doing is to continually drive this advocacy and sensitization on the need for the people to understand that the vaccines are safe and efficacious, and that they should do away with such, conspiracy theories, thereabout. Now, what we are doing now in this, phase of the vaccination program is to encourage all those who have taken their first doses to avail themselves of the opportunity to take their second jabs. We have just begun the program. It was flagged off on the 4th of June of this year. And what we also try to do is to decentralize the vaccination program in such a manner that it trickles down to the people. As I speak, immunization officers, local immunization officers have been deployed to the 25 local government areas in the state, with the primary healthcare centers in these local government areas as vaccination, centers. We have been getting results, and I have the firm belief that with this continuous drive in the advocacy and sensitization program that we are carrying out, we will be able to encourage more people to participate in the vaccination program. Suffice to state that in Delta, we didn't get any reports of major side effects or reactions, to the vaccines, etc. So that is really a plus. And we have been able to really capitalize on that. We have been able to magnify on that, making people to understand that the reactions are not there, and of course there is need, because the reasons that they give for rejecting the vaccine, apart from the conspiracy theories of this ploy of injecting microchip into the system, many will tell you that a lot of persons are likely going to come down with adverse reactions after taking the vaccines. But since the reports are not there, we're equally capitalizing on it in this our drive for this advocacy and sensitization program for the people to come out and get vaccinated. Thus far, the strategy that we have adopted thus far is really helping out, in the sense that we probably have immunization officers who have received proper training, who are currently moving from one corporate office to the other with a view to encouraging people to take their second jabs. And I have a firm belief that with the data that we're collecting, and of course with the anticipated turnout, that we are going to have more persons turning out to participate in this phase of the vaccination program. So you see, Delta State has always been on top, really, when it comes to getting the people to adhere to programs like this. You remember when we really began the war against COVID-19, you will agree with me that we adopted the best of strategy towards ensuring that we get the people to comply to safety protocols.
And that's where I'd like to come in. I haven't told us, what you're going through now with the second dose of vaccination in terms of, ensuring that there are no more cases of COVID-19. What is the state doing?
Yes, the first strategy is to ensure that we drive the vaccination program, because you will agree with me that if we have more people, taking their jabs, to a large extent, we are going to create a safer society for everyone. Because if you have your vaccine first and second dose, you will not be able to infect others with COVID-19. And even if you are infected with the virus, it will no longer be harmful. That's what we are doing now.
But there isn't enough supply for the population of Delta, is there?
Yeah, I totally agree with you. I agree. Looking at the population of Delta states, and if you juxtapose it with the number of vaccines that we have, I know it's really not enough. But I think the obligation that we have at this time is to get as many persons as possible to consummate on the vaccines that we have currently. If that comes to the fore, then you'll agree with me that a lot of persons would have been able to take their jobs, so that we can now, of course, make a case, with the Primary Healthcare Development Agency, which is, of course, the coordinating agency at the federal level responsible for distribution of vaccines, so that more doses can come in the next phase, of the vaccination program. So what we are trying to do is to ensure that we exhaust the doses available now. And I have a firm belief that with the strategy that we have adopted, with the results with the turnout that we are getting now, in no time we will be able to exhaust the doses that we have. So that in the next phase, obviously, we're spent. Thank you so much.
We appreciate your time.
Having me. I really appreciate it.
Thank you. We've been speaking with
much.
Dr. Michael Morko, Senior Special Assistant on Health Monitoring in Delta State. Thanks for joining us on the program.
Thank you so much for having me.
In the northwest geopolitical zone, Katsina State, over 19,000 clients have been vaccinated 22 days after the commencement of the second dose of the COVID-19 vaccination exercise. The state's epidemiologist and incident manager at the Emergency Operations Center, Dr. Kabir Suleiman, also explains that the frontline workers, strategic leaders targeted, represents 97% of the target of 1% vaccinated.
So far in Katsina State, for the first dose, we have vaccinated over 53,657 clients, which account for 97% of our target of 1%, which I must tell you, Katsina is one of the best, if not the best, in terms of coverage for the first dose of COVID vaccine. And presently, we're actually vaccinating the second, given the second dose of the vaccine. We're in the 18th today. We have so far vaccinated over 19,000 clients, which accounts for about 19% of our target. And we don't really have much challenge. And I believe we're going to cover our targets within the stipulated time. We don't have any person in the isolation center, but we have some few active cases that are being managed at home using the home management protocol. But we also are tracing contact, because just a few hours ago we received some results from BUK laboratory, and we have actually deployed our team to those LGAs to respond to the cases in terms of isolating them, and then contact tracing and some other measures that we normally take whenever we have confirmed cases.
It's day 4 into Uganda's President Yoweri Museveni's reimposed strict lockdown. This is in a country that included the closure of schools and the suspension of inter-district travel to help beat back a surge in COVID-19 cases in the East African country. Joining us now, Mr. Emmanuel Anyebiona, Uganda Ministry of Health spokesperson, joins us on the program via Zoom. Thank you for joining us.
Thank you very much, and thank you for having me. Evening.
All right, new measures kicked in this week: closure of all educational institutions, the shutdown of weekly open markets, suspension of church services. How bad is it in terms of the case numbers that has led to this lockdown of sorts?
Yes, over the past 1 month, we saw an upsurge in the number of COVID-19 cases reported as per the testing compared to the previous months of January, Feb, and March. So this was a signal that we are in our second wave of the COVID-19 pandemic. Cumulatively, Uganda has registered 56,000 cases since it reported its first case in March 2020. We have lost about close to 400 people. And as we talk, like statistics coming from the testing done on 8th June, it indicates that we have 1,400 new cases, which makes the situation very bad, and that necessitated that we need to control the transmission, because we have a positivity rate of about 17%. So the president thought it necessary, based on the advice of the Scientific Advisory Committee, to institute some measures which we hope will slow down transmission. And these, among others, included closure of schools, limiting to the banning of mass gathering events, closing rotational markets like for goats and cows, and also ensuring that there is no inter-district cross-district movement.
But Mr. Anyebiona, what's the reaction of Ugandans, especially how long will this last? Because now it's government trying to balance lives and livelihoods in the public health emergency.
Yes, Ugandans have responded very well with adherence to the various preventive measures and other standard operating procedures. And we hope maybe this will slow down the transmission. We are very cognizant that the economy has to thrive amidst these restrictions. So this is going to be, a number of these measures will last 42 days. And after 42 days, this will be in comparison with the epidemiological picture. If the curve is flattening, then that will mean there will be relaxation of these measures. But there is it's not a total lockdown. We are having movement within districts. Like here in Kampala, movement is going on smoothly, but you cannot cross from, for instance, Kampala, the capital, and you cross to other neighboring districts. And we hope that this will limit transmission. We're also managing our cases in hospitals, and also we are helping the people who are in their homes to live with the home-based care, and we are providing all the necessary information they need to follow to protect their loved ones.
All right, we wish you all the best in the fight against COVID-19. We'd like to thank you, Ms. Emmanuel Anyebiona, Uganda Ministry of Health spokesperson. Thanks for joining us on the program.
Thank you for having me.
The UK's Health Secretary, Matt Hancock, has rejected allegations by a former aide of Prime Minister Boris Johnson, saying that there was never a national shortage of protective equipment and the government followed clinical guidance on care homes. Mr. Johnson's former aide, Dominic Cummings, last month said Mr. Hancock had repeatedly lied in government meetings on COVID-19 and called for him to be sacked. Here's more of the global updates.
I was driving.
Mr. Matt Hancock defended his role in the handling of the pandemic relating to testing, lockdown and following scientific advice. Giving evidence to a parliamentary committee, Hancock said community testing was reduced early in the pandemic over concerns about false negatives and a lack of available tests.
You have to target it at the people for whom it might be life-saving.
India has reported a record high of 6,148 COVID-19 deaths during the past 24 hours, taking the total death toll in the country to 359,676, according to the Federal Health Ministry. Meanwhile, 94,052 new cases were recorded in the period, the third consecutive day when less than 100,000 cases were reported in a single day. The total caseload stands at 29,183,121. Algeria has set up mobile COVID-19 vaccination centers in several districts around the capital as part of a national campaign to speed up its vaccination drive. Citizens flocked to walk-in vaccination tents to receive their first or second dose, with one location in the Kitani Square neighborhood attracting 200 people on the first day of the campaign. Finally, 2 Australian states are on COVID-19 alert after an infected woman and her husband travelled from Victoria, the epicenter of the country's latest outbreak, through states of New South Wales and into Queensland, visiting dozens of sites en route. Authorities in New South Wales and Queensland are rushing to trace close contacts and locate virus hotspots. The couple may face criminal charges for breaching COVID-19 border restrictions.
Don't forget to adhere to public health and safety measures as we continue to take responsibility. Visit our website for more updates and also a better understanding of what's happening, the pandemic across the world. You also have other stories there. It's channelstv.com. That's it this evening. Thanks for watching. I'm Millicent Walker. Stay safe.